Great. So good afternoon, everyone. Good evening, good morning. Very happy to welcome everyone to today's discussion on assessing the impact of solar-powered water pumps on health, well-being, and women's empowerment in Tharparkar, Sindh province in Pakistan. So my name is Natalie Jate. I'm the Senior Advisor for Water Sanitation and Hygiene at the Canadian Red Cross, and I'll be moderating today's session. The session will also be supported by Masuma Sarwar. Masuma is a research fellow with the CRC and remotely deployed to IFRC WASH, working on cholera preparedness. And Nadia Naim, a research associate also with CRC, who's worked with IFRC and other humanitarian and development organizations, as well as the government of Pakistan and the UK. So we have a great panel of presenters here today from Pakistan and Canada. So I'll just be providing a quick introduction to this session and then introduce our presenters. And if I could just ask everyone else in attendance to please introduce yourself in the chat, just your name and the organization that you're from, that would be great. So yeah, we'll also be recording the session and taking notes using the AI note taker and some traditional note taking. So we'll be able to share afterwards a record of the session and the discussions. Ilya, was there anything you wanted to mention about the translation functions?
No, I'm just adding that in the chat as well.
Okay.
If there's any issue, you can send me a personal text in the chat and I can help resolve that.
Excellent. Okay, so today we'll be discussing the impact of solar-powered water pumps on health, well-being, and women's empowerment in Tharparkar, Sindh. So this region is situated in the Thar Desert, one of the most water-scarce areas in Pakistan, where over 80% of the population lacks access to safe drinking water. Women and girls spend up to 10 hours daily collecting water, which impacts their health, education, and well-being. And in 2016, the CRC and PRCS, the Pakistan Red Crescent Society, worked together to install solar water pumps in 10 communities in this region, reducing water collection time, improving health, empowering women and girls, and fostering education and gender equality. So this workshop is going to present the findings from this project and followed by an interactive breakout discussions on the successes of the project, as well as challenges and some lessons learned. So we have 50 minutes together. We're going to start the session with 2 presentations, followed by the breakout sessions. And then we'll have a reporting back session and discussion after the breakouts. And finally, we'll wrap up with some an opportunity for audience Q&A. So without further delay, I'm going to go ahead and introduce our presenters. Everyone, I think when I'm introducing you, please just make sure your screen's turned on so everyone can see you. And I think everyone's name is already there. So our first presentation on the project background and implementation will be delivered by Manzoor Ali and Dr. Salim Sohani. So Manzoor Ali is the program coordinator for the IFRC Pakistan country delegation and current acting head of delegation. Based in Islamabad, he is an experienced humanitarian professional in emergency response and planning, recovery interventions, disaster risk reduction, livelihoods, and cash and voucher assistance. Prior to joining IFRC, Manzoor worked with the Canadian Red Cross in Pakistan between 2007 and 2019, where he held various roles, including the country program coordinator, where he was closely involved with this project in Tharparkar. And Dr. Salim Sohani is the Senior Director of Global Health and Research at the Canadian Red Cross Society. Dr. Sohani holds a medical degree from the University of Karachi and a master's in public health from Harvard School of Public Health. He has over 30 years of experience working in Africa, Asia, and the Americas with a major focus on health system strengthening for equitable access in fragile contexts. His specific areas of interest have been epidemic, pandemic preparedness and response, and enhancing access to services for women and children across the continuum of emergency response to recovery and resilience building. In his capacity as Senior Director, he leads a multidisciplinary team of health experts responsible for providing technical advice and support to all health projects of the Canadian Red Cross being implemented in Canada and globally. So welcome to Dr. Salim and Manzoor. And our second presentation will be delivered by Ms. Urusa Kati and Dr. Faiza Rab. So Urusa Kati joins us from Pakistan, where she's the Manager of Protection, Gender and Inclusion for the IFRC country delegation. She is a social development practitioner with 20 years of experience in community mobilization and outreach, protection, gender equality, education, women's rights and emergencies, prevention of sexual exploitation and violence, menstrual hygiene management, and poverty alleviation. Dr. Faiza Rab, joining us from Canada, is a senior manager at the Canadian Red Cross, where she specializes in health and recovery and international long-term programming. She's a trained physician from Pakistan and brings valuable expertise in epidemiology and bioethics to her work, and has also recently completed a doctoral dissertation on the fragility of healthcare systems. Her career is marked by a commitment to enhancing healthcare in low and middle income countries, focusing on humanitarian aid and disaster relief. Both Urusa and Faiza recently traveled to Tharparkar to visit the project area and will be presenting the impact findings from their visit, which took place 5 years after the program closure. So I will now hand things over to Manzoor and Dr. Salim to deliver our first presentation. So if we could load the presentation now, that would be great.
Thank you, Natalie, and good morning, good afternoon, colleagues. I believe I am audible.
Yes.
Okay, thanks, great. Okay, Natalie, as Natalie mentioned, I'll be presenting the solar powered water pumps project background and implementation. If you can kindly move to the next slide, please. Tharparkar district is located in the southeast of Pakistan, is shown in the map. It's in Sindh province and lies entirely with the Thar Desert. The district has more than 1.4 million people and is unique for its diverse culture, makeup, indicating a significant Hindu minority. We can see in the map its extreme southeast bordering with India. Life in Tharparkar is defined by its harsh desert environment. The district faces extreme water shortage, making everyday survival a challenge. This challenge particularly affects women and children who are responsible of fetching water. They often walk long distances to draw water from deep wells, not only for drinking and cooking, but also for their livestock, which is vital to their livelihoods. These difficult living conditions highlight the urgent need for sustainable development, particularly in water access and infrastructure, to ease the daily burdens faced by the people of Tharparkar. Tharparkar is one of the most drought-prone districts in Pakistan. If you can move to the next slide, please. Receiving very low and unpredictable rainfall, the desert landscape, especially the sand dune areas, make access to clean drinking water extremely difficult. Groundwater is not only unusual, it's also often saline and lies deep underground. It's more than 100 meters below the surface. The harsh condition severely impact daily life, especially for women and children, um, because they are responsible to collect the water. They walk for 2-3 kilometers daily to fetch water from open well. The task is physically exhausting. These wells are deep, as I mentioned earlier, like more than 100 meters, and drawing water manually requires strength and endurance. Something especially dangerous for pregnant women as well. Children often accompany their mothers, missing out on education and putting their health at risk. Um, if you can move to the next slide, please. Okay, thanks. To address the severe water scarcity and improve living condition in Tharparkar, the Canadian Red Cross partnered with the Pakistan Red Crescent Society in 2016 and launched a project focused on sustainable water solution, named the Solar Powered Water Pumps project. With both financial and technical support, the project installed solar-powered water pumps in existing wells across 10 communities. These pumps have significantly increased access to clean and safe water by using renewable energy, which is an ideal solution for the sunny but resource-limited desert region. Uh, while installing these solar-powered water pumps, the project team has activated 10 community-based organizations and oriented them. As a result, the community-based organizations ensured proper record keeping of the community-based organization meetings and fundraising efforts. Additionally, the Pakistan Red Crescent Society District Tharparkar branch field team conducted regular follow-up meetings with the communities in 10 targeted villages uh, with some high-level achievements. Alongside infrastructure, the project also emphasized hygiene education and awareness by educating local communities about safe hygiene practices and to focus on their household hygiene in the free time. The initiative also helped reduce the spread of waterborne diseases and improve overall public health in those 10 communities. Uh, there was noticeable reduction in disease burden within the households. More water became available for livestock, supporting the local economy. Those along those pumps, the project has built a water storage tank, and there were three side the water distribution points: one for male, one on one side for female, and the other side for the livestock. So we also touched upon the inclusion in this aspect during the project implementation. And importantly, the time spent by women collecting water dropped dramatically because they just now come, they open up the tap, and they collect the water, and they go back, giving them more time for their families to focus on health and hygiene for their families. This initiative shows how thoughtful, sustainable interventions can make a lasting difference in vulnerable communities. Last year, in 2024, a qualitative research study was conducted with the help of my colleagues. They will be sharing that shortly to evaluate the impact and long-term sustainability of the water project, this project in Tharparkar after 7 years. The assessment involved project site visits, focus group discussions, and key informant interviews. Our colleagues, Faiza Arusa, as Natalie mentioned, they engage with wide range of stakeholders, including project staff, men and women from the community and government officials. The findings were very encouraging. They will be sharing that shortly, but now I would like to hand over to Dr. Salim Suhani to further share about that research and to also share because he was kindly supporting us and providing us the technical support during the implementation of this project. So now I will hand over the floor to Dr. Salim to further walk through us about the project. So
Thanks, Mansoor. Thanks for giving that background. Against that background, I will just highlight a couple of key points. One, that this project started as towards the end of the recovery project from 2010 floods in Pakistan. So when we started this, not a lot of money was available to do this, but that small amount that was invested in community to do this kind of work led to a huge sustainable effort, which we are interested, and we were super interested in learning more. What we observed was that because community was effectively engaged and empowered, and the whole project was addressing the true needs of community, we find that community groups really took lead in maintaining the project. And there were times when there were issues with the pumps for the repair and kind of thing. Community took charge and managed to do some of those work. So the project was completed sometime in 2017-18, as Mansoor was mentioning. When we did a mission in 2020, when I did a mission in 2023 towards the end, people were telling me that this project is still working, which was amazing to hear. And we wanted to do a thorough lessons learned research kind of exercise as to what sustained, why those things sustained, what typical things were done. As Manzoor was mentioning, a lot of social mobilization was there, community-based organizations and women groups that were created around this perceived and real need. They really took the lead in implementing and carrying this project forward. Despite our departure, even 7 years down the line, the project continued. So I'll hand over to Faiza and Rusa to talk about that research and give more insight into what they found when the research was carried out.
Great. So we can move now to Faiza and Urusa's presentation.
I'll be sharing that.
Okay.
Give me a second. Okay.
Oh, okay, we can see it.
Okay, I'm just gonna put it in presenter mode. Okay, great. So you can see it, right? Okay. Can you hear me?
Yes, we can hear you.
Okay, great. Thank you. I'm just going to be very brief, and I'll let my colleague Arusa talk a little bit more about the findings. It was a great privilege. For all of us who are in a humanitarian sector, we know very well that it's a rare opportunity that we get to go back years after we've closed the program to see what is the real impact on people in the community. Unfortunately, we were there for another flood response when we got an opportunity to go back and talk to people and see what kind of impact the work that we had done from 2016 to 2018 had on the communities, and the findings were really really amazing, and Arusa is going to talk a little bit more about that. But I also want to acknowledge some of our program people within our international operations who were there in the beginning and were always interested in supporting, especially Andrea Peters, who was very instrumental in providing us with the background information, and our head of region for Asia Pacific, Carla Taylor, who supported our us going back into the community and talking to the people. And that underscores and highlights the importance of just gathering evidence and understanding what went right, what went wrong, and how can we improve going forward in terms of these really, really important interventions that we are working on. So without further delay, I'll hand it over to Arusa to share some of the findings. Over to you, Arusa.
Yeah, thank you very much, Faiza. Can you hear me?
Yes.
Yeah. So thank you very much, Faiza and colleagues. We basically got opportunity to visit district Tharparkar and conducted meetings with women and community organization, male community organization, women groups, and we also conducted meetings with social welfare department and public health engineering department over there to see the impact of the project on different community groups. So when we had interaction with women, we saw that this project has like multifaceted impacts on the lives of women and girls. So, when we had interaction with one community group where we were talking about women and women's like issues, how this project was benefited. So women replied us, and they pointed out their young daughters coming from the school. So they were saying that this is the biggest impact we achieved from this project, that now our girls are going to school. They have enough time, so they can use this time and go to school and attain their education. So that was the biggest impact we also witnessed over there, and we also interacted with those girls, and they were very happy. And the other thing that this without before this project, as my colleague Manzoor shared, that the fetching water from deep well is very difficult for women, especially women who were pregnant. So there were a lot of cases of women who lost their babies, miscarriages, because of this overburden, heavy physical work. So that was also a great relief to those women who were busy for 8 to 10 hours of their daily routine to fetch water and use this water for not only their home chores, but also for their livestock. So even women told us that they don't waste the water on for their body wash, for utilizing for kitchen gardening, but after this project they have enough water, so they use this water for kitchen gardening, and they apply this water, use this water for their personal hygiene and for their kids hygiene as well. So that was a great impact we observe over there. And as you know that in Pakistani society is very patriarchal, especially in rural areas. We witness that women are not allowed to go outside to take part in public life and take part in decision-making processes. So this was, the project also provided a lot of opportunity to women to make their community-based organization women group and discuss about their different issues. And they also, through this project, they also received a lot of awareness session on their basic rights and health and hygiene and menstrual hygiene management. So that awareness also greatly benefited to them. Can you please change the slide, Faizan? Yeah. So these are basically after the implementation. And it was very strange, because I have been working in the development sector since many years. So after 7 years, we saw that the solar powered pumps were active and using by the community members, and we also observed their great ownership to they were collecting small money for the maintenance of these solar water pumps and all these things. So the ownership was there, and the women were very active, and they also when we asked that how the health and hygiene awareness session benefited them, so they said that we know that how we can make ORS, how we can the importance of hand washing, and boiling of water. So these were the practical information they have, and they are practicing it in a way, and these practices reduced the burden of diseases in their community. So it is basically, the project greatly impacted women as well, and now they are participating in different forms. You can see there are different meeting pictures here. So women have now somehow like liberty to sit together to talk about their personal issues, about like menstrual hygiene management issues, and the decisions related to their life, to their like girls' education, to the marriages of their daughters. So it is basically the social impact of the project we witnessed during our visit in the communities. They are also engaged in kitchen gardening, and they offered some fruit to me and Faiza, and we were very happy that this is the fruit of that project, and the project has also reduced the daily burden of women, and now they spend their time on income generating activities. Through this project, we also provided them sewing machines. So some of the women are basically earning from that support. So thank you so much. Over to you, Faiza.
Sorry, apologies. I didn't mean to mean to rush this. It was just forwarding the
No problem.
slides quickly for me. We also published a blog on our work. You can scan the QR code to look at the blog and get more information on that. I'll share the link in the chat as well. And one of the things I think that was really significant in this project, that was unique as well, that when these solar water powered pumps, when the project was completed, instead of handing over the solar water powered pumps to the government or other authorities, they were actually handed over to the community-based organizations. And we saw that they felt responsible because it was their pumps, and they were doing continuous repairs, and that's how they had a sense of ownership of those pumps, as well as the community-based work that they were doing. I'm going to stop sharing here and share the link to the blog in the chat if anybody is interested.
I've already shared, Faiza.
Thank you very much, Dr. Singh. Have I stopped sharing? I don't know.
Yes, I think you've stopped sharing.
So, Natalie, do you want to guide people around?
Yes, I'm just going to actually, so Masuma, I think the breakout rooms are ready. So do
Yes,
you want to just quickly explain how people can enter the assigned breakout room?
So you just have to go to the more option where you see the three dots, and you can just hit join the breakout room. And I have assigned to 3 breakout rooms, so you can just go into the breakout room that is assigned to you, and it's for 15 minutes. You will be getting a notification when 1 minute is left, and then we all can come back to the same room and discuss what we have talked about in the breakout room.
Can we share the questions for the breakout room, Natalie? And maybe it's is it 15 or 10 minutes, Natalie?
Yeah, 10 to 15, we should be okay. The questions are in the chat. Hopefully everyone can see them. If not, Masuma's going to be coming between the breakout rooms, can check on us to make sure we have the questions, and we'll be asking for a volunteer from each breakout room to report back on the discussions after we're finished. So I think we can get started, and everyone can go into the different rooms now. And just, yes, let us know if you're not able to see the questions.
I will just stay, I will listen to the summaries afterwards. So I'll stay here.
We have 3 more people.
But people that are still here, if you have any trouble finding the room, just let us know.
Okay, I'm going to one of the breakout rooms to see how things are going.
If you have any questions about the breakout room, just feel free to speak up. Hello, Anna, I see you just joined. People are in breakout rooms, so you're welcome to join the breakout room as well. Thank you. Thank you, Anna.
I just saw somebody join, so I had to assign them, so I had to come back.
Oh, that was Anna, I guess.
Okay, so I just assigned her to room 3. Okay,
Yeah, and I just put in the chat how you can go to the rooms as well.
yeah.
Have you checked them all, or?
No, I was just in room 1, so
Okay.
I'm gonna go back to room 2.
Yeah.
Okay, so I have closed all the breakout rooms, and I think everyone should be coming back to the main room in 50 seconds. Okay.
It's nice that you can see who is where, so I didn't realize that.
You can see that, right?
Yeah.
And now it says 30 seconds. They should be coming back.
Yeah, because they have to close in 6 minutes then, huh?
Yes,
Natalie.
have 6 minutes left. So the 5 minutes is just going to be reporting back what happened in your main, in your breakout room, and this just question answers.
So you can close the breakout room? Oh, no.
Yes.
Yeah. Okay.
We didn't get any questions in the chat, right?
No,
Because I didn't see anything. Okay.
no, I didn't see anything as well.
Okay.
I put
Okay.
out questions in the chat, so for the groups.
Yes, we were just trying to, I was trying to explain how to leave, but then I think we just all got redirected here. So
Yeah.
just, just check, is everyone back in the main forum now? All the breakout rooms are closed?
Yes, they are. Everyone should be back.
Okay.
So the number
great.
should be plus 20, so we should be sure that the people are back.
Yeah, I think some
Perfect.
people didn't join and left. So there's 18 people here now.
Yeah.
Okay. So we have 15 minutes left.
Actually, just a correction. It's 5 minutes actually, which you have to leave 10 minutes to the whole hour.
Oh, okay.
Yeah.
5 minutes left. Okay.
So
I think,
yeah. So maybe note takers can do 1 minute of report back, and if anybody has questions, they can send to us, and then send all their notes to you, Natalie, or Nadia. Yeah.
yes, sorry about that. I thought we had up until the hour. So very quickly, maybe we can start with the room number 1. If someone from room 1 wants to give a quick summary or
Nadia,
wants to
can I
speak up.
just, I'll quickly summarize the discussion. There was a discourse between, well, the overall message was that community engagement is really important, and we need to respect the communities. There was a really good perspective from ethical humanitarian perspective, where we have to trust and respect the communities versus changing the beliefs, which may be detrimental to people's health. So we agree that community engagement is important, and to make sure that we respect and build the trust of communities.
Great, thank you, Faiza. So from room number 2, I was in room number 2, and I'll just speak very quickly, and then maybe hand it to Manzoor or Kathy. We spoke quickly about the overall objective about the research and what was kind of one of the drivers for going back and doing this research at this stage. And then we also had a very interesting discussion on the point that Kathy raised from a similar project in Vietnam, and basically how to work around some of these gender issues, especially with the reluctance of men to actually work with empowered women, and how this was overcome in our project. And Manzoor, or Kathy, did you want to share any specific anything about what you shared on how the project actually overcame that in Tharparkar?
Sure. Yes.
Just for a minute.
Okay. Quickly, Kathy, question was that how did you overcome this issue to sensitize men? So what we did is in this project to excite the female. So what we did is in this project is we work with the male community members. They are sitting in the autark. Autark is a communal place. Autark is a local language name. We work with them. We provided some kind of equipments like a solar plate, a water cooler, cards. They are playing cards in that place. They're sitting there. So what we did is we went there. we did the social mobilization, as Dr. Salim mentioned earlier, with the male communities. We sensitized them that this hygiene, health and hygiene is utmost important for your families, for your females. So after that, we went to the female through our female volunteers and staff, and we worked with them through this health and hygiene sessions and their menstrual hygiene and other education and all those things. So we sensitize the male first, and then we work with the females through our female volunteers and staff. Just to Natalie, you can add.
Great, yes. Yeah, that's a great summary. I wish we had more time. We have 1 minute left, so I think we just have to go quickly to room 3. If anyone wants to share some feedback from room 3.
Rusa?
Oh, yeah. Thank you. We had some discussion around similar like kind of topic that how community engagement is important, and we should ensure the regular follow-ups of these projects to ensure the sustainability. And the other suggestion was that we should ensure that some influential people should not take over and get the benefit of these services, rather than everybody in the community should have equal access to these opportunities and these services. So we talked about this, and another, I think, question was like suggestion was related to not solar power but wind energy. I think some lady was like saying that how about wind energy, wind powered like panels for water supply and all these things. Salim, you want to add something?
No, I think you covered it well. It was like in the area where sun is not abundant, could we use the wind power or other mechanism, as well as some discussion around inclusivity and governance kind of thing. And in this particular case, because women beneficiaries were kind of on the committee, this was really good.
Okay, well, I think it looks like we're out of time.
Natalie, Masoma, I think you agree or not? I just checked the schedule. I only see one session being planned at 3:30, so it seems like there's more time. The only reason that you have to leave earlier is because this link has to be used by other presenters, but there's no session until 3:30, so you don't have to rush through it.
Okay, so we can go up until
If ever somebody
3.
comes in, then I'll have to stop, but I don't think so.
Okay, so we have a few more
You
minutes.
can take a few more minutes, yeah.
Yeah, so I guess maybe I will open the floor again to any of the presenters or audience that wants to pick up on some of those topics that we were rushing through. So the floor is open.
I could kick a start, Natalie, that clearly one of the issue where people generally feel difficulty is around governance, empowerment kind of thing, right? And this project really demonstrated that those issues can be effectively addressed if community mobilization is done well. Then what I also hear from your group 2, was around engaging men. How did you engage men? And I think Manzoor elaborated on some of those things. So I was just picking few of those things up, but I can see Ian, your hand is up. Please go ahead.
Thank you very much for this great discussion. I think I came in late. I didn't introduce myself. Apologies for that. My name is Ian Itolondo Mutoro. I'm from Kenya. I was just shared the link by one of your colleagues in Kenya, and I'm really glad to be part of this discussion. I'm currently in Europe, Slovenia, for an exchange program, but I'm studying a master's in One Health and Emergency Research Ethics at the University of Nairobi, in partnership with Ohio State University and Kenya Medical Research Institute. And I'm glad to be here today. So I just wanted to talk about the aspect of the political aspect when it comes to implementation of these projects. I would like to take an example from the recent USAID issue whereby a new administration came in and some of the projects that were being done in various countries, very many countries were no longer carried out because of the cut in the funding. So how are we going to make sure that we come up with policies that are not affected when there is power change? Because most of humanitarian organizations, some of them are funded by the government. And the main goal of a project should be having a long-term impact towards a community, towards a particular community. How are we going to address such political issues when it comes to implementation of issues such as resources? Because without the resources, however innovative the solutions are, they can never be implemented adequately. Thank you.
Ian, I think you are raising such an important question that everyone is facing. And what we found really amazing in this project, as I was mentioning, that with very small money, the project continued for almost 7 years without after our departure. So no donor was there. And this really gives a good example whether the administration gets changed and USAID or any international funding is there or cut. If you properly empower community, and even before empowering community, if you are working on their true priorities, if this is community's priority, they are engaged and you allow them to engage, you build their capacity, then the sustainability and the longer term programming continues. This is a clear case where it continued for almost 7 years after our departure. So this is something that could be done, but I could see two more ends. So I'll keep quiet.
Sorry, I'm just going to be very brief. I think what we saw firsthand was the fact that the community was the owners of those solar water power pumps. They felt empowered. Women felt you could see how empowered they felt because they were also community-based CBOs created for women, and they were doing all the administrative work. So they felt that that sense of empowerment. And one more thing which didn't come out in our presentation is the aspect of connection. The project finished in 2018, but then there was another project that started something entirely different, but there was a connection up until 2022 where somebody from PRCS was going every 2-3 months or 6 months, and one thing that the community really asked for is nobody, like somebody, it's nice to have somebody show up. So they were very happy when they showed up. So just visiting once every 6 months would be enough for them to be motivated and keep going as well. So I see Zainab's hand. Go ahead, Zainab.
Sorry, great presentation. I just had a question, I guess, like to follow up with you about community engagement and effectiveness. And it seems like this project was very successful, like the outcome measurements, especially with community engagement. So you're seeing like very high numbers. So is there any plans to like scale this project to another community in Pakistan? Because, there might be similar issues. So is there anything in works, or is this sort of what you're just working on now?
Would anyone like to take that question?
Maybe we can put Manzusa on spot.
Yeah. we actually we spoke about this very briefly in our group.
This question was floating in my mind as well. Yes, of course, but we are showcasing this project to different donors. The one thing, Turkish Red Crescent was interested, and they build upon on this project. They added the kitchen gardening component to this project in not in all 10 communities, but in a few communities. We also submitted a concept note to the Swiss Red Cross in 2021, but they could not work because of other reasons. They could not come to Pakistan. They wanted to come to Pakistan and establish their delegation here. So yes, we are planning. The Pakistan Red Crescent Society is committed to replicate this in other parts of the country. But of course, that needs some kind of resources. Resources, I mean financial resources. They have the capacity to implement the project, but they need some kind of financial resources. But we are available to support them technically. Yeah. So
I'll just quickly
yeah,
Sorry, I'll just quickly add from the community perspective. What we heard was the communities that these projects were implemented in were really keen to take the next step. So build upon what they had learned, and it was really amazing. Like Arusa mentioned, they understood, they recalled everything after 7 years in
yes,
terms of health and hygiene, and they were actually practicing everything. So, and they said, we want more education. Now we want to do
yeah,
better. So they are already primed and ready to deliver it. And one last thing, I see Ilya's hand up. One last thing is that the program manager there, Mr. Jam Singh, he had a very keen understanding of the local context in with regards to what the impact of climate change is. So engaging those local leadership who know what is coming from their own experience and context, and then they also have solutions there.
yeah.
So I
One thing.
think
I am gonna have to interrupt because I got a sign that we do have to sign out now. So I think we're gonna have to wrap up, unfortunately, but I'll hand it over to Nadia for that. Natalie, sorry.
One thing quickly, 30 seconds. Sorry, Natalie. Further, adding to what you have mentioned is the district branch of the Tharparkar is there. That is sustainable. There, the branch is in the social welfare department, so that itself is sustainable. The branch is there. They do not need any kind of resources, anything. They are committed. The Jam Singh, he continuously following up with me about this project. When you are coming back, when you are coming back. So you see that that thing is there. You know, the ownership is there from the communities, from the branch people. So that's what I wanted to add. Over. Sorry for this extra time.
No problem. Thanks so much, Manzoor. That's really, it's very, very good to hear. So thanks again to all the presenters, especially those who stayed up very late in Pakistan to provide your valuable contributions to this session. And thanks also to the audience for your participation and all the interesting and very thought-provoking discussions. So take care, everyone, and hope you enjoy the rest of the sessions. Bye.